Hey, what's up? This is Dr. Richa and we are on Dental Minutes. Now, today we are going to be talking about a very common problem that I see in my dental practice, and that is dental caries or dental cavities or tooth decay, or quite simply a hole in your tooth. Did you know that a hole in your tooth is generally the last manifestation or the last display of this disease? And yes, dental caries is a disease. So now how exactly does this happen? How exactly does a tooth decay? So it's quite simply by a process called as demineralization of the tooth or loss of tooth structure. So now for this demineralization to occur, there are certain bacteria involved. Now these bacteria are generally present on the tooth surface and they are called as cariogenic bacteria. Now some examples are Streptococcus mutans, Streptosobrimus or Lactobacilli. Now did you know that generally in people who have a high amount of dental decay or many caries in their mouth, most commonly you are going to see Strep mutans or Streptosobrimus in their mouth, whereas lactobacilli is generally present in the plaque biofilm. Apart from these, there are numerous other bacteria which are present, which are involved in this process. So now what happens is that these bacteria feed upon our diet, that is the sugars from our diet. Now these sugars could be your glucose, sucrose or fructose, and most commonly you will find them in sweets, sugary drinks, sugary beverages, chocolates, etc. etc. These bacteria can also cause a breakdown of simple carbs or simple starches from our diet. Now, these simple starches, common examples are your white rice, pizza, pasta, etc. But did you know that these bacteria cannot break down complex carbohydrates or complex starches? Examples I have given below. Now, once these bacteria feed upon the sugars or the starches from our diet, as a byproduct, they produce certain organic acids. Now, what happens is that these organic acids enter inside the tooth, and once inside the tooth, they can partially dissolve the minerals of the tooth, that is the calcium and phosphate. Now, this mineral of the tooth is also called as carbonated hydroxyapatite, and it is acid soluble. Now, since it is acid soluble, it gets dissolved by the acid and it comes on to the surface of the tooth, and once outside, it is washed away by the saliva. So now one of the earliest signs of this process of demineralization is a white spot lesion or a white spot on your tooth. Now this is called as demineralization of the tooth, and most of the patients will miss out on this. But if you go to your dentist during this stage, the dentist may be able to stop it or reverse it by prescribing you certain fluoride mouthwashes or prescribing you a fluoride varnish or certain regenerating toothpaste. But if you miss out on this process of demineralization will keep on continuing, and more demineralization areas will be formed within your tooth, and eventually it will lead to the formation of a dental cavity. So now to summarize, we know that there are certain bacteria involved in this process. These are your cariogenic bacteria. They feed upon your dietary sugars, dietary carbs. They produce organic acids. The acids get inside your tooth. They start dissolving the minerals of the tooth. The minerals of the tooth come out on the tooth surface and they are washed away by the saliva, and you're left with some areas of loss of minerals within the tooth, and this is how a cavity forms, or this is exactly what a cavity is. I hope that was helpful for you, and we'll get on some more videos on this in our future series.